We couldn't.
Hi, good evening, everyone. This is Carrie. I am the Director of the Division of Child and Adolescent Health at the Michigan Department of Health and Human Services. On behalf of our colleagues at Michigan Public Health Institute and our state MCH team, we want to welcome you to our webinar on preparing the FY19 MCH Plan. Thank you so much for joining us today. I don't know how the weather is in your neck of the woods, but I can tell you that yesterday we had 55 degrees and sunny, partly sunny weather, and 12 hours later we are in the midst of a snowstorm. So if you are experiencing similar weather conditions, you're probably happy that we're doing today's meeting via webinar, and I hope you are in your offices and cozy and you don't have a lot of driving to do. So welcome, thanks for joining us. We're going to do some brief introductions of the people here in the room. And Julia, I'll let you go first.
Good. This is Julia Heaney with the Michigan Public Health Institute.
Good morning, everyone. This is Lauren Lepine with the Michigan Public Health Institute.
Good morning. This is Ann Madden with the Michigan Public Health Institute.
Robert Bourne with MDHHS.
Hi, Rudy Ash with MDHHS.
Before we get any further, I'm going to turn things over very, very quickly to Lauren with any housekeeping items and reminders as we start our webinar.
We just wanted to remind everyone it would be really helpful to us if you could mute your lines. We are experiencing a little bit of feedback, so it can be kind of difficult to present with lots of feedback. So either, if you're calling in via phone, if you could mute that line, or if you are calling in on your computer, if you could mute your both your speaker and your microphone, that would be great. If you're having any issues with that, please feel free to use the chat box. We can work with you directly to mute your line.
And let's just remind you to not use the hold feature. The hold feature will let us all hear your music, and it will be a very great distraction.
Great, thanks so much. Just to kind of get us started, as you all are aware, over the last couple of years, we have instituted a number of changes to our deliverables associated with LMCH, specifically our plans and action plans. And we know that that has been a struggle. And on behalf of our team, I just want to say how much we appreciate all the patience you've given us, appreciate the time and effort you have gone into developing this year's plan, FY18, and last year's as well. Our goal of today's webinar is to provide practical support to all of you. So tips, suggestions, ideas as you develop your FY19 plans. We want this to be as smooth of a process as we can have, and I just want to remind you that both of our teams are here for support even after this webinar. If there's anything that we can do to provide support or technical assistance, please let us know. We're happy to help out. We have a pretty full agenda today, as you can see, and we have some time at the end for questions and discussions. So again, thanks for participating and joining, and I believe this webinar will be archived, and I think this is a webinar that people will probably want to go back to and look at different slides as they work their plan. So thanks for joining us, and look forward to a good discussion. I'm going to turn things over to Lauren, I believe.
Yep. Thanks, Carrie. So we just wanted to spend a little bit of time this morning just reviewing the LMCH needs assessment and talk about where we've been and how we are going to use the needs assessment to inform the MCH plan development moving forward. So as you all may remember, and if you were involved, in 2017, we completed a 9-month maternal health specific needs assessment process. We utilized the the MAP framework and went through kind of 8 steps. We started by organizing for success, engaging community partners, creating a vision for maternal and child health in the community, and then we spent a good chunk of time gathering assessment information. This process involved 3 different types of assessment. As you all may remember, we did a status assessment where each local health department looked at some data and indicators for maternal and child health in your community. Each health department completed a systems assessment, so really looking at the MCH system and infrastructure and identifying needs and gaps in the community. And then we also did a community themes and strengths assessment. So really gathering input from community members, use qualitative data to kind of fill some holes where you might lack some quantitative data. In step 5, we spent a lot of time interpreting assessment data. So really looking at both the qualitative and the quantitative data and turning that into meaningful information for communities. Step 6, each health department identified strategic issues and then developed goals and objectives off of those strategic issues, And this is kind of a really important point that we'll come back to throughout the webinar today, and will really inform the development of your FY19 MCH plan. And finally, to close out the needs assessment, although assessments are always, we like to say that they're ongoing, you develop strategies and drafted action plans. Again, a lot of that work is really helpful and will inform much of your 19 MCH plan. So everyone has probably seen this slide many times, and we just wanted to reiterate that for the MCH needs assessment and for the plan moving forward, we really utilize a kind of a life course approach. So looking at data and indicators that affect your community's health, starting at pre and interconception and being up all the way through adulthood. So this will integrate across your MCH plan, and you'll continue to see this moving forward. So we did want to let everyone know, you may remember that we sent out a follow-up survey after the of the needs assessment. We really wanted to thank you for taking the time to take that survey. And what we did, we asked for a lot of feedback around everything from the format of the needs assessment tool through the feedback that you received from both MPHI and MDHHS. And your feedback was really helpful to us so that we can improve these processes in the future. So we create kind of a different infographic report that summarizes your results. And that will be posted on the LMCH SharePoint site. It's actually there right now if you'd like to look at the full report. We summarized some of the different responses that really stood out to us in both quantitative and qualitative results. And we were really happy with the feedback that we received. So really, thank you for taking the time to complete that survey and give such valuable feedback. One thing that really came out of that survey, we asked for the kinds of technical assistance that would be helpful for you moving forward. And we learned that some technical assistance in 4 main areas would be helpful. And those areas were identifying evidence-based strategies, moving from assessment findings to action planning, determining outputs, and how to use data to inform the LMCH plan. So all of those results were really part of the impetus for the webinar today, and we're hoping that we can cover some of those issues and answer some of your questions today. But that being said, as Carrie pointed out earlier, we will be available, both MPHI and MDHHS, continue providing technical assistance on these areas as well as any other areas that would be helpful to you moving forward. And with that, I'm going to turn it over to Trudy to do an overview of the Title V block grant transformation.
Good, everyone. We've been talking a little bit about the Title V block grant transformation over the past couple years, and so it should not be a surprise to you to know that the Title V block grant has had the transformation at the federal level, which has moved down to the state level, and then down to the local level. And at the federal level, they're really asking us to have a heightened focus on an ongoing needs assessment. We have to do a 5-year comprehensive needs assessment at the state, and then we have ongoing needs assessment that helps supplement that, and then we'll have another 5-year needs assessment in just 2 years. Other pieces that we use the assessment findings to select our priorities, and we are looking at a data-driven process, really making sure that we're looking at defined and structured measurement system. There's an added emphasis on evidence-based or evidence-informed practices. And it's really a shift nationally away from activities that are direct services or those kind of activities that are paid for out of a third-party billing system, and more toward enabling services and public health functions of the pyramid. So we know that here at the state, with the transformation that we're having to do at the state level related to the federal, that it's kind of challenging to go through a transformation. And that we have some challenges as we've gotten the new guidance from the federal government, and we have to make some modifications to what we've been doing. And so changes is stressful. so we know as we've the transformational process to the local level, and we've made these changes in the past couple years, that this has been stressful for you too. We've heard it from you one-on-one. We've heard it, you know, rumblings at conferences that we've gone to. So we know that this change is stressful. We've also heard that people are worried about a few things, so I want to put some myths to rest. Some are worried that the MCH needs assessment that was done in 2017 might not have bubbled up the actual strategies that you want to use for local MCH funds in the future. And we know that it might not have bubbled up because you have this funding source to help meet an unmet need, and that's the reason why things are going well in your community, and that's the reason why perhaps a strategy that you're using local MCH funds for didn't come into your assessment. And that's okay. If you need to continue using MCH funds in that way, and you can give us information about why you're doing that, we're perfectly glad to continue to see you using your MCH funding in a way that you might have previously. The other thing that we want to acknowledge is that there has been a lot of change, and maybe 5 years ago, 10 years ago, local MCH funds might have paid for strategies. We didn't really look carefully to see if they were addressing the most pressing need and a strategic way in communities. And this is something that the federal government's asking us to do, and this is something that we're asking you to do. And so we know that that is difficult. We also know because of the way that we need to report outcomes to the federal government, we've changed how you have to report things to us. And so sometimes the reporting outcomes and reporting your expenditures in the way that we're asking you to do that is cumbersome and even burdensome to you. And so we don't want things to be cumbersome and burdensome, but yet we are tied to some federal constraints as well. So we have to live with some of those constraints. So what we're trying to do, given all the challenges that we have with transformation, is to make things be as simple as possible as we move forward. And so one of the things that we really tried to do as we looked at developing the fiscal 19 local MCH plan is we really tried to the action plan and make it relate very concisely to our MCH needs assessment so that it really helped you to take assessment data to your strategic priorities into the action plan. And so we're going to outline that as we go forward in our presentation. Let me think, there's something else that I was supposed to say. Forward, really looking for in your plans, and when we ask you for additional information, we're not trying to be critical or overly fussy, but we're trying to understand where you are at in moving forward with the process. So we look forward to having you critically, having us to understand how you're thinking critically, to help us think critically as we move forward. So we look forward to working with you in this process. I'm going to turn it over to Julia.
Thank you, Trudy. And before I get started on the content here, I'm going to do another reminder about muting your lines. We are hearing a little bit of feedback, and we've switched our platform a little bit, which has allowed us to no longer mute everybody on our end. So we're all kind of in it as a team here. So if you're calling in on your phone, if you could mute your phone line, that would be great. If you are calling in through your computer, if you're connected through your computer, if you could turn off your computer's microphone, that will make it so that we can't hear through your computer. And if you're not quite sure how to do that, let us know and we can help, or you could, of course, disconnect from audio over the WebEx and then call in using the conference line and then mute your phone. So I know that's complicated. I wish we could take care of it on our end, but we can't. So if you could take those steps, and if you're not sure how, reach out to Aaron or Lauren here at MCHI. We'd be happy to help, and you can just do that right through the chat box in the WebEx. So thanks again for that, and sorry for the feedback that we're getting a little bit today. Okay, so we're going to talk start this part of the session talking a little bit in more detail about some definitions, both needs assessment in general and certainly mobilizing for action through planning and partnerships specifically are really terminology-heavy sorts of things, and the way that terms are used within within that kind of context can be a little different than how we use it otherwise. And Title V is the same way. It's very terminology-heavy, and it's not always entirely clear what those words mean or how they relate to one another. So we're going to spend a little bit of time this morning just kind of talking about terms and kind of getting on the same page about what they mean and how they apply to your LMCH plans. So first we're going to talk about, with a reminder kind of about what strategic issues are. During the needs assessment process that you went through, one of the steps in that was identifying strategic issues that you want to address for your community. And as a reminder, MAP defines those as fundamental policy choices or critical challenges that must be addressed in order for a community to achieve its vision. So step 6 of the needs assessment process, you identified several of these strategic issues to tackle. One of the challenges in thinking about the relationship between a strategic issue and then a performance measure is that there won't be that really nice one-to-one alignment necessarily between what you identified as a strategic issue and the performance measures that you have available to you. The way I'd like you to think about that is that performance measures should give you a signal of progress toward addressing the strategic issue you identified or other priorities you're focusing on with your LMCH funding. So it might not be a one-to-one relationship between what you articulate as the issue for your community, but the measure itself should tell you, are we making progress around this kind of general concept? And we'll give some examples in just a second to make that a little bit more clear, because I know that's a tricky one. So within the context of Title V, they have 7 different types of measures that states select from when they're writing their Title V block grants. So based on the state's needs assessment in the last round, the state identified a set of national performance measures and developed their own state performance measures that they're working toward at the state level. So these are measures of the system's progress as a whole in Michigan toward priority outcomes for Michigan as a whole in this population. So the national performance measures are a set of short-term and medium-term performance measures that utilize population-based state-level data derived from national data sources and for which a state Title V program tracks prevalence rates and works toward demonstrated impact. So what I would point out to you within that definition is that all of the national performance measures, or NPMs as sometimes we refer to them, are measures that can be pulled out of national data systems that all the states can report on, and just by that nature, they are a limited set. They're not as extensive as what you could measure at the local level. They're not as extensive as what Michigan can measure at the state level, because they have to be measures that can be compared and compiled across the whole country. So after the state's needs assessment, some of the strategic issues that the state identified align reasonably well with some of the national performance measures, and those were the ones that were selected. For some of the strategic issues that the state identified didn't align well with the national performance measures. State performance measures were written to kind of fill the gap. So state performance measures are similar to national performance measures, but they can be based in data that are available at the state level. Here in Michigan, again, line up reasonably well with the strategic issues that are identified. And HRSA gives states that flexibility to select state performance measures, or SPMs, where there is that gap or disconnect. For local CH work, the state is giving local health departments that same flexibility that HRSA gives states to develop local performance measures where there's a gap between what you identify as strategic issues or needs in your community and the measures that were selected through the state's needs assessment, recognizing that there absolutely could be locally identified needs and concerns that don't align well with those measures. So the local performance measures are there to kind of create that space between what you identify locally and what the state identified as priorities as a whole. as a overarching takeaway from that, when you're selecting an NPM or state PM, what I'd encourage you to do is think about if it is a signal or a trigger that you're making progress toward your strategic need or your issue that you identified for your community. And if there's an NPM or SPM that's a reasonably good fit, select that. AIR is not an SPM or an NPM that's a reasonably good fit that feels like it would work as a signal of progress, and a local performance measure in that case is the way to go. And if you're not sure, just reach out for help. Trudy and Robin or us at MCHI are more than happy to help you figure out what's the direction to take if you're not really sure. I do think that's a tricky aspect of this process. So as an example of the relationship between what I'd identify as a strategic issue and a performance measure that you could select, we'll look at that for a second on the next slide. So, for example, if you have a strategic issue that's what can be done to increase the number of medical providers in our community so families have access to the medical care they need, if that's a strategic issue you identified through the needs assessment process, you might select a performance measure from the Michigan's NPM list of the percent of women with a past year preventive medical visit. There's not a perfect one-to-one alignment between that strategic issue and that measure, but that measure would give you a reasonably good signal of progress toward addressing that strategic issue. So it's the best fit, probably, within that type of strategic issue. If you get the second one, how can our community increase access and awareness of mental health services for the maternal child population? There's an NPM that fits that really well, but there's an SPM that might be workable in this case. One of the SPMs is the percent of women enrolled in MIHP who are screened for maternal depression, and that might be a reasonably good signal of progress toward the strategic issue. In the case of the third example, how can we ensure every parent has access to the information, support, and resources to support healthy child development? There probably isn't an NPM or an SPM that's a particularly great fit for that strategic issue, but there are other indicators you could use. For example, you might look at locally the rate of substantiated child maltreatment as an indicator of progress around that strategic issue. So as you can see in all of these cases, it's not a perfect fit between the performance measure and the strategic issue because the strategic issues are by their very nature a broader and more inclusive and kind of complicated concept than what you could ever capture in one single measure of performance. But the performance measures are kind of a rough signal, again, of progress toward the issues that you're identifying that underlie those strategic issues. Okay, so within your LMCH plan and within the needs assessment structure, there's kind of these three really critical, important categories of you have to be able to apply in kind of both of those contexts. So we're going to talk a little bit about what each of these things mean for the LMCH action plans, as well as kind of how they related to the needs assessment. So as a reminder, when we're saying objectives, we're talking about SMART statements of what will change as the result of implementing a strategy that will get you closer to your goal. About strategies, we're talking about a general approach to achieve your intended outcomes. And when we about outputs, we're talking about evidence that strategies were implemented. And we're going to dive into each of those categories in more detail. So objectives, first of all. I read that definition. I used the acronym SMART, which I think a lot of us are familiar with. But just as a reminder, that is referencing making sure that measures are specific, measurable, achievable, relevant, and time-bound, all within one statement of what you hope to achieve and by when. Objectives should reference both your baseline level of performance and your performance target in measurable terms, and I know that that can be a big challenge because you don't always have the baseline information that you wish you had around the measure that you would most like to use. And I think that this is probably a goal to work toward in the way that you're thinking about and articulating your objectives is being able to specify your target and your baseline, but it's a really, really important thing to be able to work toward doing, especially because within the context of your LMCH action plans, you're asked to report on progress. And if you have a clear baseline and a clear target, and you measure something on an ongoing basis, that reporting becomes really straightforward and gives both the state team and you locally a really clear sense of if your strategies are helping you make progress toward those things that you wanted to change as articulated in your objectives. So although I know it is a challenge, I'd really encourage you to think about ways that you can include that baseline and that target in the language of your objective. Again, if you need help thinking about what data to use or how to think about that or how to get the data that you need, again, we're a resource for that. Objectives also should be really very clear about what will change for who and by when. And again, when you're looking at this locally or when it's being looked at the state level, when you're clear in your objective about these pieces, what's going to change, who is going to change for, and the time frame of that change that you're expecting, the reporting aspect of it becomes really straightforward and clear both for you and at the state level. So within the needs assessment process, and also within the LMCH action plan, so there's this relationship between goals and objectives, and goals kind of set the framework for the objectives that you describe. So when you talked about goals in either of those contexts, you might have a goal that's like supporting breastfeeding in settings where women live, work, and play. So it's a broad concept of how you want to see change happen within your community. Translating that into an objective is not dissimilar from going from strategic issue to performance measure. Again, it's going to be a signal of progress towards your goal, just like performance measures are a signal of progress towards your strategic issue. It's that thing that you can track that tells you, are we making some progress? Of course, it's going to be more succinct and more focused than the broad goal, but again, it's that signal of progress. For this case, you could write an objective by September 30th, 2019, so that's the time frame. Increase percentage of WIC clients who breastfeed, so we're talking WIC clients, that's the specific population that you're talking about, that's the who. And who breastfeed at 6 months, that's the measure, from 15% to 20%. So we see there a baseline of 50%, a target of 20%. And this isn't a perfect one-to-one alignment around supporting breastfeeding in all settings, but you might hope that if you're supporting breastfeeding in all settings, then the WIC clients that you serve and have this data for specifically would benefit from that expanded support in all settings for breastfeeding. It's the data that you have access to and the population that you're working with directly that you can use as a place to gather information about whether or not this is changing. Again, it's a signal of progress toward a goal. SMART objectives, again, it's one of those things that kind of sounds easy when you hear about it, but then when you get into the details of it, it can feel confusing. So as a reminder, there was one of these webinars that really focused much more on writing objectives that was held part of the needs assessment process, and that's something that you can access through this YouTube link that we have on this slide if you want to revisit that. And again, of course, I'd invite you to reach out to us for help as well if you're into it and it's just more complicated than it sounded like when we were talking about it today or as it sounds on that webinar.
And I want to point out we are getting some questions in the chat box. The slides that we're presenting today are already posted on the LMCH SharePoint site, so it would be helpful to you to have those to take notes on. Feel free to click the link on the SharePoint site and download them there. Sorry, Julia.
Oh, no, great. Thank you. I was not noticing the comment, so have to stop anytime. Okay. So the second piece that I wanted to talk about following objectives is strategies. So in order to get to an objective, you'll put in place a strategy or series of strategies to achieve that objective and achieve that broader goal and address the strategic issue. All these things kind of roll up like those little dolls. I can't think of what dolls, never mind. So identifying strategies. So we identify strategies related to each strategic issue in what sounds like a straightforward way, but is actually fairly complicated in practice. And I would like to point out that I know that with the needs assessment process being as quick and abbreviated as it was, we didn't give you nearly as much time as we would have liked to go through the action planning process in a comprehensive way, because it's just as difficult as gathering and looking at assessment information as gathering and looking at information about strategies that'll really be effective at getting that strategic issue and addressing goals and objectives that you set out to accomplish. So I think that this is a great time within your work over the next couple of months here to think really deeply about the strategies that you'd most like to use to get to the objectives, goals, and strategic issues that you identified through the needs assessment process. So there's a couple things that you can do to identify strategies. You can of course brainstorm. You know a ton about what's going on in the field of public health and in sister fields, and you have colleagues around you who also have a lot of depth of information about strategies that are out there, things that might work. Brainstorming, talking with others can be a great way to identify ideas. You can also certainly search the research literature to look at right now what is the research telling us is most effective at addressing the issues that you identified for your community. And there are lots of great resources for folks that have already done the research literature reviews and compiled what looks like it's working right now in public health. And on the next slide, there's a whole list of websites that you can go to get that information. And we're also happy to connect you with resources if you're not seeing or finding what you need, or if that process just seems really daunting, which certainly I think it can. There is a lot out there, and there's a lot to sort through to help. I think the third bullet is also extremely critical in identifying strategies, is talking with the people that you serve and that you want to be supportive to. What would work for them? What are their needs? And how could those needs be met by a health department and its partners? Things that work in one context might be totally inappropriate in another, and it's the people who you serve who have expertise and can share that wisdom with you as you're thinking about what strategies to use. So an example on this slide around related to that last question we were pondering is about how can we reduce barriers to breastfeeding. And there's lots of different kinds of things that you could do that reach different levels of that public health pyramid or the maternal child health pyramid. That first strategy, you could think about developing feeding plans with MIHP clients. There's some evidence that feeding plans can be helpful in bridging that translation from pregnancy to childbirth and initiating breastfeeding when there's kind of a clear plan in mind for what you're going to do, how you're going to do it, and what that's going to look like, what support you need, that kind of thing. That could be a strategy that's used within the context of a specific program. Second idea, expanding the number of health department staff trained as lactation consultants. This is something that I think is gaining a lot of momentum in the field of public health. There's lots of health departments that have taken the step of making sure that health department staff have some certification and expertise in lactation and lactation support. So that's a workforce development strategy. How can we make sure our workforce is prepared to do the work that we're asking of them and do it in an effective and evidence-based way? That third strategy is really a system-level strategy of increasing the number of workplaces with breastfeeding policies. We know from the research literature that we see a big drop-off in breastfeeding when women return to work at 6 weeks, 8 weeks, 12 weeks, any of those time frames when maternity leave ends, and not feeling like not having the time or the space or the support when they return to work to breastfeed. So working with employers on what it looks like to support breastfeeding and why that's so important for women and families, but also the broader community, including workplaces, can be a powerful strategy for making breastfeeding more accessible for a longer period of time to more women. So the next page, so I go through that just to say that lots of great ideas out there, interesting ideas, things that could expand the way that a health department approaches a particular issue, and taking that time that we didn't give you in the needs assessment process enough of, taking that time to step back and say, what's the best way to do this? What's the most effective? What makes the most sense to us and our community and our clients can be really beneficial in developing a very robust and comprehensive strategy. Okay, so on the next slide, there is a whole list of great resources on evidence-based strategies in public health and its sister disciplines. I'd really encourage you when you are thinking about addressing a particular topic in a new way to jump in and see what folks have come up with. There's lots of wonderful ideas out there that are worth considering.
Just wanted to point out that attachment E of your LMCH notification, we put together a document with evidence-based strategy resources. So we've got all of the strategies that are listed on this slide, and then some additional ones that are, some are clinically related. And the guidance that we received from the federal government had a couple of pages of great, very specific resources to national performance measures, so we included that as well in the read that we had, attachment E.
Thanks for that reminder. Okay, so once you have a good sense of the strategies that are available to you, of course, you can't do everything. So there's a need to kind of prioritize. And as you're prioritizing, I'd encourage you to think about a couple things. One is, of course, the strength of the evidence. And as a part of that, thinking about the strength of the evidence relative to the community that you serve. Unfortunately, a lot of research still happens with majority white population, and that's not necessarily going to apply to a population that is not white or that speaks a different language or comes from a different culture. So considering whether or not the evidence is relevant to the population you serve is important. However, going back to that idea of the strength of the evidence, there's always more research being done on particular ideas and ways of approaching health improvement, and identifying what research has found doesn't work and does work can give you good guideposts as to where to focus your energies and efforts, because of course we all want to put our limited resources into the things that work best. I can say to think about the reach of the strategy in public health, always thinking about how do we make change at the population level, in addition to making changes with specifics we're working with. But if you can put your funding and your resources into a strategy that can reach more people and make a broader impact on moving the needle, then that's certainly something to consider in the balance of things here. Of course, feasibility and buy-in are also really important pieces to consider. Is your health department ready for this? Are people going to be excited? Are they ready to implement a strategy of this nature? And is it going to be doable within the time and space and funding that you have at hand? And of course, I have some bold and italics here because I think one of the most important considerations is the perspective of community members you hope will most benefit from a particular strategy. There's lots of stories about evidence-based strategies being implemented in a particular context, and it falls flat. It could have been prevented by asking people, does this make sense to you? Will this work here? And you can get some really great insights through taking that extra step. Okay. Outputs versus outcomes. Outputs are the last kind of piece of this three dimensions of definitions that we wanted to talk about today. You're asked to articulate outputs both in the needs assessment, and then for your LMCH action plan, you have outputs that you identify. And outputs are fundamentally the products, goods, or services that can be counted or observed to tell you if a strategy was implemented. So it tells you plan to implement the strategy, did that happen? It's just that evidence that something was implemented. But it doesn't necessarily tell you, did it work? Did it achieve the change that you wanted to see happen? It just tells you, did it happen or not happen? And that's what distinguishes it from outcomes. So outcomes are the intended result or consequence that occurred because a strategy was implemented. So that's where you see the evidence that a strategy worked. But within the context of the LMCH plan, you're really asked to articulate outputs, that piece that will tell your state partners that the strategy that you planned, the actions that you planned were implemented, that they happened. So we'll go some examples to look at this more specifically. So to imagine that you put in place an objective of by 9/30/2019, you'll increase the percentage of WIC clients who breastfeed at least 6 months from 15% to 20%. And you go through the process of looking at different possible breastfeeding strategies, and you decide that what is will work for the population you serve, what makes sense within your health department and has good evidence behind it and so forth. So the strategy that you implement is to increase staff expertise in lactation to better support clients who choose to breastfeed by training 3 WIC staff and certified lactation consultants. The output that you would report back is that, in fact, those 3 WIC staff became certified lactation consultants. So it's that evidence that the strategy that you put in place or plan to do happened, that it took place, that it occurred. Way that you'll indicate whether or not that achieved what you wanted it to achieve is, again, by tracking progress toward your objective. You have both of those 2 things that you'll be reporting on, and the reason that that's important is, of course, you, in order to see a change in the objective, you would have to have achieved that strategy first. So there could have been something that happened with a staff or availability of training or the time frame of training that made it so that those 3 staff couldn't become certified within the time that you expected, and so your expectations about achieving an objective would also have to shift accordingly. So there's that logical relationship between the 3, making it really important to report on both what you planned happened and did what you expected to happen because of it happen. With this kind of concept of articulating objective strategies and outputs, there's kind of different levels or ways to think about setting objectives for yourself, and I think the way to think about this sometimes is around time frames of when a report has to happen. And here we have by 9/30/2019 increase the percentage of MIHP clients who have a feeding plan in place before their baby is born from 0 to 50%. You set an objective like that that's really kind of thinking about what will happen first, what's the most short-term thing that would happen. But you're putting the feeding plans in place for a reason, which is to achieve this next objective, which is to increase the percentage of MIHP clients who initiate breastfeeding from 15 to 25%. So you want the feeding plan being put in place to lead to that objective of initiating breastfeeding. So as you're thinking about setting objectives, I'd encourage you to think about how you want to see change for clients in that outcome space. So if you can go toward that second type of objective, that's great, because you can see that the work worked, that the thing that you put in place had the effect that you wanted it to have. Sometimes the time frames are too short, or you expect that change to take a longer period of time, and so having an objective that's really looking more at that short-term immediate change that you want to happen is important, and it's meaningful, and it's the best you can do within a particular time frame. So there are those kind of 2 types of objectives that are possible and available, with the latter being kind of the stronger objective to put forth for yourself.
I'm just going to say one thing, that as you're looking at your objectives related to the realistic component, sometimes, like, this is a pretty big objective that is used here, from 15 to 20%. We're looking at local maternal child health plans on an annual basis. So this might be too big of a jump for you. It might be realistic to take a smaller jump, and in some measures, it might even be realistic that the measure is as small a jump as 1%. So I just list that to your, because we want to see people be successful as they report out, and so many people take out sort of by more than they can chew in an annual basis. So,
thank you for that, Trudy. So that's meant to be really realistic about setting objectives that of a change that you could really see within the time of a year that you need to set within these plans. So here we have another example of the relationship between objectives and activities and strategies. So the strategy in this case is to incorporate feeding plan into MIHP service delivery, and that includes the steps of developing a template, training staff, testing it with a small sample of clients, adapting the template, and then using the template with all prenatal clients. And again, thinking about what's realistic within a specific time frame, what you can achieve. An output might be the feeding plan template itself. That might be where you can get within the time that you have available and the resources. But maybe you could get a little bit further and produce evidence that plan template was completed with a particular number of clients within that time frame. So just to kind of illustrate that objectives and outputs can be thought of in a couple different ways depending on the time frame and resources that you have available to you to implement. And just a reminder of Trudy's encouragement to be really realistic when you're setting those objectives and determining how far you can get within a particular time frame. So finally, just one last note about outputs. One of the questions that we often get is, how many outputs should we say that we are going to achieve? Because with any strategy, there can be lots of activities, and those activities can be rather overarching or they can be super specific, and almost every activity could be translated into an output of some type or another. And when you did your plans in the context of the needs assessment, each output was linked to an action step. So that was a pretty minute way to look at measuring outputs. My sense is that when you're doing your LMCH action plan, you're looking for those broader signals of output rather than having an output that's every single sort of minute activity. What are the major outputs that will happen once the strategy is implemented? So just keep that in mind, I think, as you develop your plans. And since we're jumping into talking about the plans, I'm going to turn it over to Trudy to take it from here.
I'll wait till it's done. We're moving the phone here in the room. We want to make sure you can hear me really well. When we developed the local MCH plan this year, you'll notice that it has a similar appearance that it has had in the past 2 years, but we did try to give it a little bit of a facelift. So that's what you'll see here, and we're going to go through it. The first thing that we said on page 1 is that we have some new information to share with you this year. As you know, we participated in the MCH needs assessment in fiscal year 17, and we want you to be able to use that big needs assessment as your baseline reporting for this next 5-year period, just like we at the state do that as well. That doesn't take you off the hook from doing needs assessment as an ongoing activity, but you can use the needs assessment that you did in 17 to help inform your progress as we move forward. And to really highlight the MCH needs assessment tool that you used in fiscal 17, we put in red wherever those things correlate together. So you will see that. That's on the first page. And then on the first page, we have asked for you to give us some overview information and maybe some additional information if needed. So we have to, with our annual report, give just kind of a little brief overview of what's happening in our neck of the woods in this state, and we're asking you to do the same thing, what's happening in your neck of the woods with that first question. We are this first component about identifying demographics, geography, economy, healthcare environment, disparities, that links right to the local MCH needs assessment. You remember in step 1 and in steps 4 and 5, you can recognize the tables that are there. We have identify some things in table 2 and in table, I can't read them from here, let's say table 7 and table 8. And so you can go right to your needs assessment to help fill out this information. We try to be really in tying things together. Is there anything that we're supposed to say there? I don't think so. On page 1, we're just having a brief overview. And also, we wanted to know if your ongoing needs assessment has led to any change in your strategic issues that you prioritized in 2017. So if you have some new needs that have bubbled up that you want to use your local MCH funds for, this is the place to tell us about that. You may not have any new ongoing needs assessment activities that change your strategic use. So this question you might not have to answer, and if there's no changes, you can just put there's no changes. Question about the emphasis that the federal government has on making sure that we talk to our consumers, the women, children, youth, and families that we partner with. And that was a very large component of our MCH needs assessment, and we want to keep that in the forefront. So we want to understand how you're using families and consumers and stakeholders as you move forward with your LMCH planning. Julia said, as you're talking about strategies and implementation, ask people. That's really, she had that in bold text because it's so important. And so we want you to briefly tell us about how you're doing that in question 3. And that links to the needs assessment, step 1, where we specifically asked about that and we asked how you were engaging families. Question number 4, this is something that we didn't include in previous iterations of the local MCH plan. This really does build on the MCH needs assessment, steps 6 to 8, where you were identifying priority strategic issues. And so we want you to list 3 to 5 priority strategic issues that you identified, and let us know if you're planning on using the local MCH funds to address this need, or maybe you're using other funds to address the need, so there's a place to indicate that. And then you can indicate if this is a strategy that you're continuing that you identified in 2017, but maybe there's a new strategy that you want to use, and so you can indicate that here. If you're using a new strategy, we want to understand what was the data and what led you to prioritize that as a strategic issue. So keep that in mind if you have a new strategic issue. And again, all of this was linked to the local MCH needs assessment, so it should be work that you've already completed unless there's a new strategic priority in steps 6 through 8. Next, we're asking you to identify the performance measures that you're going to be using your local MCH funding toward based on your priority strategic issues that you identified. And I just want to have everybody be aware that the federal government is giving the state an opportunity to reassess the performance measures that we selected. And so as a result of that, in our ongoing assessment, this is actually going to be retiring 3 performance measures, 1 state performance measure and 2 national performance measures, so those are highlighted here. I just wanted you to be aware of that if you hear anything about it. But if you are working on those particular performance measures with your local MCH funding and you want to continue to do that, you certainly can continue to do that next year. But you'll be phasing that out as we go along. If it's a really strong need in your community, you can still use that performance measure in the future, though, beyond 19 as a local performance measure. So don't panic that we just happen to be retiring them. And these, let's see. The next page of on page 4 of the plan talk about narrative justification to why you selected the performance measures. If you selected a measure that doesn't align with one of your priority measures or strategic issues, to include the data of why you selected that measure. So we've had this similarly in the past. And the other thing that we really ask is, what is your budget justification that you're using MCH funds here? So, we really want to understand that there's no other source of funding for you to be able to do this particular performance measure, or that you really need it as a gap-filling measure or something like that. So that's what we're looking for in the fiscal budget justification. We did a little bit of a facelift in the work plans. We really tried to align this action plan to our MCH needs assessment. So the part of the action plan on when you look at table 15, which is coming up, it has the priority strategic issue at the top, the goal, and the objective. And so that's what we did with the local MCH action plan as well. We'll have you identify which performance measure the action plan is about, and we will still be asking for a separate action plan for each of the performance measures. You can see that the goal you identified in Step 7 of the MCH needs assessment, so that was Step 7, Table 13. And the objective was also now in that same table, and so you can literally go to your MCH needs assessment and lift that information right into your plan. I hope it's that simple as you're moving forward with your action plan. So that's part of the table that's it has a little different look than it did last year. We also included, we had a lot of discussion about including this data component here, and decided that we really wanted to leave the data component in the action plan. The reason why we want to leave the data in the action plan was for a couple of reasons. The first reason is that the federal government is really asking us to be data-driven in our approach. And so having the data column here, smack right in all of our view of what is the data that's supporting what we're doing for this particular action plan. Also, the objectives that you write need to try to have some baseline data and some targeted data. And so the baseline data can be right here so that we understand exactly what the baseline data is. And as Robin and I are reviewing the plans, it's really helpful for us to not only have whatever percentage is that you have, but also a raw number. So that's helpful for us to understand how we're going to really work on this particular performance measure to change and to get the output that you want. That's why we kept that data column in, and that's why it's so important. And it gives us a quick snapshot as we just look across this landscaped paper, that's 8.5 by 14 paper, to see everything all in one full swipe. And data relates to the local MCH needs assessment, steps 4 and 5. A lot of data might be from the health status assessment, but you might also have other data from the community themes and assessment that would be important to include here as well. The next column is the strategies column, and this strategies column we added that was not previously in other iterations of the local MCH plan. We added it because it went along with the local MCH needs assessment. It made sense to make sure that you have your strategies there, and it was an oversight that we didn't include it in the past, I think. And so you can see that the strategies are listed on I can't read the tables from here. This is very good. Table 14 and Table 15. So you can just take those things that you had in your MCH needs assessment and lift them right into your LMCH action plan. The next part is looking at what your action steps are. And we previously called them strategies / action steps, so we separated them out to match Table 15 so that you're really thinking about that strategically. Under the action steps, we're really looking for the specificity of what activities you're going to be doing in to meet the criteria in the national performance or state performance or local performance measures. And these are the steps that will be broken down by service of the pyramid level. So that's a pull-down menu in the purple there where it says select service by pyramid level. And you can pull it down and you'll select either direct services for children, direct services for women, enabling services for children, enabling services for women, or public health functions. And those pyramid levels are how budget is lined up. So we understand that this is confusing, and we're confusing and that it's complex, but that is how we have to report things to the federal government. That's why we do it that way. This part of the table should line up really nicely with Table 15, the action plan there, so you can just lift your information that you thoughtfully created with the MCH needs assessment in 2017 and put that into your fiscal 19 LMCH plan. say one other thing about the anticipated outputs, I'm sorry, that before we get to the plans, is that when Rob and I look at the anticipated outputs, we're not actually looking for a specific number at this time, because you don't really know what your number is. So you'll be reporting what your output actually is in the final reporting. So we might say that you're reporting on, you know, the number of children who, I don't know, initiated breastfeeding, the number of infants who initiated breastfeeding. And then when you actually go to report on your output, you'll have that number or that percent. But we're not, you don't really know what the number of outputs that you are, so you have to put a specificity of a number in that anticipated output. Well, the last two columns in the plan are the reporting columns, and obviously these yellow columns are columns that you will leave blank as you're doing on your action plan, and these two columns will be the columns that you report on at the end of the fiscal year when you submit your final SR. Getting a buzzing in there. We also, in the local MCH plan, gave you 5 different pages to put different strategies on and different performance measures. If you need to have more pages, or you certainly can cut and paste and add more pages if you need to. If you need to adjust that under one performance measure you're doing 2 strategic issues, you can do that. It's just hard to make the format be exactly specific like each health department needs. So if you need any help with adjusting that, or you can't figure out how to do that in Word, just ask Brendan and I. We can help you with that. Or MCHI can probably help you with that as well. We've given them a copy of our as well. And then the last page is our outcome table. It is called, that's not what it's called. Let's see, I have it right here. I have it out of sequence. It is called the Projected Outcomes and Fund Allocation Table. And so this is very similar to what you've had to do in the past. We're asking you to anticipate how many people that you will serve in these categories: women, children 0 to 9, adolescents 9 to 19, and then how much money you are allocate for each one of those projects. And that's broken down by performance measure and then by the 5 project categories: direct services for children, services for women, enabling services for children, enabling services for women, and public health functions. And as it was last year, if you highlight the table, there will be a little hatch key on the top left, and then you hit the F9 key, it will total the table for you. So all the purple columns are totaled for you. Am I supposed to do the tips and tricks? Okay. The tips and tricks, we have heard, or we have observed some health departments to do some things that have been really helpful to help keep things sort of easier for people. So the first thing is to keep it manageable. And one way that you can keep it manageable is to try to limit your performance measures to maybe 1 or 2 things that you want to work on with your local MCH funds. And maybe you might consider putting all of your activities under one of the pyramid strategies instead of 5 of the pyramid strategies. So maybe you're going to work with enabling services children, and you might do that in your immunization work plan and maybe your transition with children's special health care. And so all of your outputs then are in only one service project in the enabling service children. So that makes it be easier to track things because you're only tracking 1 project line, 1 budget line, and 2 performance measures. So decide to not take our advice and do 5 performance measures and all 5 service peer levels. It's a lot of things to track and to try to manage. So I just really encourage you to limit it to keep it manageable. Keep it measurable. As I said, be realistic about your measurements. It might be realistic to have a small increase as you're thinking of your objectives, so keep in mind. We really need people to be thinking more about evidence-based and evidence-informed strategies, and as I said, we gave an attachment E some more information about that, and we hope to be focusing more on that this year. I think people have asked for more information, and so stay tuned. We'll see things come with the plans and what additional resources you might need as we move in that direction. And make sure that you use the great work that you did last year with the local MCH needs assessment. Use that as your guide or your compass as you move forward. We do know that there could be some new emerging needs assessment that bubble up, and certainly you can use those, adjust things as you move forward. And this is really critical, is that try to focus on unmet needs wherever it is possible. So MCH funds can be used as a gap-filling need, or it can be used on these unmet needs. It's really difficult, some of those direct service lines where you can have third-party reimbursement. If there's a capability for third-party reimbursement, like giving immunizations or doing scanning services, we need you to use as the first line of budget those health plans and Medicaid and third-party fees instead of MCH. And please communicate your challenges. We might understand your challenge, so we might call you and say, help us understand what we can do so that we, or what the challenge is, so that we can then help you problem solve, because we want this process to be as simple as possible, and we want to move forward in a collegial partnership and really try to help in whatever way we can. So, do you have anything to add, Gary or Robin?
Okay, are hearing some background noise, and I'm not sure if someone might have joined, but if you could please mute your phone if you're on the phone, or use *6 to mute if you don't have a mute button. So if you have called in over your computer or laptop, if you could mute your computer's microphone, that will help eliminate the feedback that we're hearing on the line. Unfortunately, there's nothing we can do on our end necessarily to fix it. So please take that step to make sure that you're still on mute. That would be super, super helpful. Thank you very much for that. So this process of developing a work plan, of thinking what these different categories mean and how to get sense for the work that you're doing and be really reflective of the work you're doing, it's really hard. It's really tricky. And as in looking at the MCH plans, as they've come in past years, there's lots of things about them that are really great. Lots of examples of strengths and assets and things that are going really well. There's also opportunities to improve, to clarify, to strengthen, and to improve alignment with what the Title V block grant transformation is requiring. Ultimately, I know that Carrie and Trudy and Robin want to be able to very clearly articulate all of the fabulous things that you're doing at the local level with these funds to protect maternal and child health. It's the documents that you send in, the work plan that you send in, the report that you send in that allows them to do that. So we want to make sure that those documents are as strong and clear and compelling as they can possibly be. So that's what we're going to talk about in this next piece. So what we've done is we've looked at lots and lots of examples of LMCH plans and identified some themes of where there are opportunities to strengthen the plans, to clarify the plans, and we used examples that, you'll see examples in here that are reflective of the challenges, but they aren't coming from any specific health department. So you're not seeing any particular health department's work reflected here. Again, what we did is look across the plans and identify kind of themes of challenges that we saw, and then developed examples based on those themes that were reflective of challenges, if that makes sense. Okay, so opportunities for improvement. The first one that we're going to talk about a little bit is lack of specificity and objectives, and so this goes back to that idea of doing as much as we can to make objectives SMART. So the example we see here, by 9/30/2019, there'll be a 1% increase in the children between 19 and 36 months of age that will be up to date with the recommended series of vaccines. There's lots of really good strengths within this objective, lots of things that meet those SMART criteria, but there's a couple gaps. And you can see in the slide in red where we would recommend making a couple changes to make it even more of a SMART objective. So you see by 9/30/2019, there'll be a 1% increase from 76% to 76.8%. So again, specifying where you were from the beginning to where you'd like to go. And the percent of children between 19 and 36 months of age living in Greene County Health Department service area that will be up to date with a recommended series of vaccines. So here we're seeing specifying the baseline and the target, being really clear about what it is that you're measuring, really clear about the specific population that you're talking about, because that could vary quite a bit. You could be talking about your WIC clients. You could be talking about a city within a broader county or multi-county service area. You could be talking about a couple counties in your district health department. So being specific about what you're talking about from the beginning is really helpful. Ultimately, there's no way to really clearly report on progress against an objective if they're not specific enough. So it's great to take the time to add in those pieces to make it really meet all the SMART criteria. And again, if you're having any trouble with thinking about how to do this for something that you want to measure, reach out for some help.
And here is that this is mathematically correct. Sometimes people will say there's a 1 or 2% or whatever percent increase, and they just add 1% or 2% to 76. Like they might say a 2% increase is 76 to 78%, but that's not really a 2% increase mathematically. So I just want you to go back to your math.
And that can be one of those confusing things in phrasing, because the phrasing of those two concepts is so similar. So just being the baseline and the target gets you around all the confusion and gets you toward an objective that makes sense to everybody. The challenge that we saw across some of the plans that we reviewed is using objectives that are really more like outputs than they are like objectives. So objectives, again, we're trying to get at changes for the population that you're serving versus something that is evidence that you implemented a strategy. So the example here, we have 50% of WIC program clients will complete a satisfaction survey describing barriers to initiating and continuing breastfeeding. So doing a satisfaction survey with WIC clients is a great thing. But in the objective, what we'd like you to do is articulate what would change because that satisfaction survey was completed. How is that going to inform improvement for WIC clients? So you might think about an objective like by 9/30/2019, the percentage of WIC clients served by Greene County Health Department who breastfeed through 6 months will increase from 20% to 22%. Again, we kind of overshot in our examples of baseline and target here. We should have done something a little more concise. However, the idea here is saying that if you survey WIC clients about their satisfaction, their needs, then you can do something to improve continuation of breastfeeding, and that's what the change we want to measure. You might think about an output that's something like the number of eligible WIC clients completing a breastfeeding survey, and then in the reporting section of the plan, you might report as an output that 79% or 54 out of 68% of eligible WIC clients completed the breastfeeding survey. Another challenge that we see that's more related to the activities and strategy section is sometimes it's not totally clear what the strategy you're implementing is, and that can be for a variety of reasons. Sometimes like a program acronym is really familiar within your community, but maybe not familiar to someone outside of your community or somebody looking at it. or it's kind of described in a really brief way without saying what it is. So making sure that you add those additional details can be really helpful for the reviewer and saying, oh, this is a really compelling, interesting strategy, versus kind of feeling like confused what the strategy might be. So here we have an example. A strategy might be screenings of unnatural causes. But having a little bit more detail about where those screenings are taking place, who the audience is, and so forth can be helpful in understanding what it is that you have in mind. So you might change that to something that's a little bit more descriptive, like host monthly screenings of natural causes and locations throughout the community for community and business leaders and residents, and facilitate post-screening discussions. And again, that's so the folks reading the plan know what it is exactly you have in mind as the strategy that you're putting into place. Make sure we know what the strategy is all about. Another challenge related to the strategies and activities that are identified in the plan is that there seems to be, as we review the plans, a real emphasis on health education and providing direct services, which are, of course, really important functions for local health departments and absolutely things that health departments can and should be doing, and that's great. So nothing to say that health education and providing direct services isn't important. In the transformation of the block grant, there's definitely an encouragement to think about other levels of the public health pyramid, and there's encouragement to make sure that there's not direct services provided that could be paid for by other sources. So again, just that idea of thinking about the diversity of what a public health department can do, and making sure that we're thinking about options. We're identifying strategies, kind of that broad brainstorming approach to figuring out what strategies could be put in place is I think, something to think about as you're formulating strategies in the future. So here we have an example of the kinds of strategies that we see really commonly in the plan. So there's education for clients, education for parents about nutrition, educating providers is another really common strategy. Again, all really important. But there's other really important public health strategies that we see a lot less of in the plan, and some examples of those are on the right side of the slide. So supporting hospitals and becoming baby-friendly in workplaces and implementing breastfeeding policies, expanding access to healthy foods through convenience stores, grocery stores, and farmers markets, pursuing ordinances that require lead abatement by landlords. There's lots of ways to do public health really well and effectively, and as you're thinking about strategies, we just encourage you to think about what the evidence base is for the strategies that you're putting in place and the root cause ultimately of the problem that you are trying to tackle. If the root cause is that a lack of information or education, then an education strategy is absolutely the way to go. If the root cause is something else, then thinking about options for tackling those root causes is important and powerful and persuasive. A challenge that we see sometimes in the activities or strategy section of the LMCH plans is implementing strategies that are not necessarily evidence-based or not evidence-based at this point in time. I think that flyers have been an important way of sharing information about public health concerns. Incentives are a really common way to try to get folks to engage with programs and attend activities. There's kind of increasing evidence that incentives work for some populations, for some types of activities, but also that incentives don't work for some populations and some types of activities. So making sure that the evidence is strong, that the strategy that you're putting in place is likely to work is really valuable and important. And because the evidence is always changing and becoming more robust, there's some good value in making sure that there continues to be that alignment between what you're doing now and what the evidence is now. Another thing to keep in mind as you're thinking about implementing strategies is that it can be really helpful within even the context of your LMCH plan to use it as an opportunity for reflection. So if you're using incentives, for example, have been using incentives to increase engagement with a particular program, you can look kind of historically to say, have those incentives worked? Have they gotten us what we wanted to get? Are we seeing really good retention as we have provided incentives or not. And if the answer is not, then I think that's evidence as well. Even if it's not research-based evidence, it's evidence, practice-based evidence to consider if there might be another strategy that you might want to implement. So here the example is kind of moving from flyers to thinking about more comprehensive strategies for community education, more aligned with what the evidence is telling us works now for education and changing mindsets and ideas about health with the community, and thinking about moving from incentives to thinking about doing that really client-specific sort of work of asking clients what they want and need and modifying programming around what those wants and needs are. There's increasing evidence that doing that tailoring based on client voice can be really powerful in improving engagement and retention with programs. Okay. Your anticipated outputs section of the MCH plan, there's a couple things that we noticed that you could consider in your next iteration of the plan. We noticed that sometimes outputs end up being kind of a repeat of what you specified as an activity. So we might see an activity like program supervisor will monitor referrals for mental health services. An output like 90% of clients with a positive screening for depression receives a referral for mental health services, and so forth. You can kind of see the examples here on the slide. But again, we want to make sure that the outputs are what happens because of an activity, not a repeat of the language of the output. Okay, that was a lot. We've talked for a long time, and now is your chance to put us on the spot, because we know this is hard, and it's, you know, we can come up with an example and put them on the slide with a lot of time to think about it and all of that, and without the kind of specifics of what you're struggling with as you're thinking about your own planning at the local level. So this is an opportunity, I think, to help us understand what you're struggling with related to your LMCH plan, as well as to help us respond to and answer any questions that you have about aspects of the plan structure that we can potentially be helpful with. So we do have the echoing issue on our line, so if you'd like to talk, please just mute your phone and remember to remute, but you're also very welcome to use the chat box to ask questions, and it looks like we already have a question coming from the chat box.
So we have, can we use MCH funds to conduct a QI project related to a priority issue? Her hands.
Trudy,
I do. I'm pausing, so I would say I probably need more information, but overall, yes, the projects are great.
and it would go in public health infrastructure. Yep, that's a good one.
Question.
On the phone, referred to the application in the very beginning. You had referred to question number 2. And my question is that also the place to say when didn't bubble up in our community assessment, but we're going to use it as a tool because, you know, in the past, we know it's an issue, but it just bubble up because we're already doing it.
You put that information in question 2, or I think we changed that last question here. I'm trying to say.
We're in the room here.
You can put it in question 2 or also in question 6. It says, based on table 2, provide a narrative justification as why each was selected. If you select a measure that doesn't align with one of your priority strategic issues, include the data here. So really we're thinking that you will put it in something. Cut and paste, just put it in place. Does that question?
Thank you.
what answer?
Second question.
Good.
So I am wondering, in regard to the actual action steps that we are going to write, how broad should they be on the external document that you receive versus the community assessment one that we did? So, for example, through my community assessment action steps, some of the steps got fairly down deep and in depth about, you know, who was doing what when. Do you want that much detail on the external, or should they be more broad, or?
Question to answer, because sometimes people put such broad information in the activities that we can't really tell what you're doing. And we don't need to be, you know, in October we're going to do this the first week, and this is the second week, and this is the third week. So we don't need that level of specificity. So I kind of somewhere in between. That's a kind of a gray answer, but we need enough specificity to really understand what you're doing with the funds, but not enough specificity that we're wading your weeds to understand it.
Boxes you into something. Like, we don't need a time frame on it. We don't necessarily need to know the person that's doing it unless somehow that's helpful to you. But, I mean, specific enough, like Trudy says, so we can see what the action steps are that kind of are leading up to your activity or objectives and strategies, but not so specific that it, you know, isn't helpful to you or boxes you into things unnecessarily.
Sense. So in follow-up to that, on the part where we have stakeholders and responsible person, are you looking more for whether it's the health department or our MCH system partners, or specifically which role within the health department, or would it depend?
It's also going to depend too, because we've seen some people really collaborate with partners that are working with you to achieve a specific activity or objective, and so it's helpful for us to understand that you're working with those broader partners. But then sometimes it's as simple as the person that's responsible for that particular objective or activity.
Great.
Question about, again, where to find the slides, which is a wonderful question. So we're send that link out to everyone in the box. We also had a question about how do you make action plans more specified if your coalition hasn't decided what to work on yet? So that's a great question, because when we're working with partners, sometimes the time frames line up quite the grants do. So what thoughts do we have about that?
Well, I think that might be your action plan, that you're working with your coalition to build additional action plans or review what assessment data you have to help you move forward if you need to adjust your strategic priorities.
That's the same thing. I mean, the work plan and action plan should reflect where you authentically are in your community in terms of your progress around meeting a priority issue. So if you're in the planning stages or in the, you know, your coalition's meeting and actively planning and strategizing what their specific thoughts or plans are going to be to address that priority issue, then that's what your plan to us would reflect. I mean, we want to see a complete work plan comprise only that type of activity, but certainly if that's like authentically where your community's at, that would make sense to have that in your plans.
Any questions on that question, or additional questions that come to mind? Okay, another pause at the end for questions. So we will wrap up our content and then ask again. So feel free to add things to the chat box or just to give some more thought to what you might want us to speak to. So just, we get a question one second.
Long-term coalition is not a new one, just have a hard time picking specific things to do. Ahead. Well, the other piece of advice that I can give related to that is that there is always the amendment process. So select something in the middle of the year that you really feel you want to adjust your local MCH funding and fund something. You can do an amended plan and an amended budget, and we can work on it that way. And the other.
Yeah, I think it also, yeah, I totally agree. It also depends, you know, a little bit, like on like how much money are you anticipating spending on that plan or that component of your work plan. If it's a major focus of your overall plan and your overall allocation, we're going to need, you know, more specifics sooner rather than later. If it's a small part of your overall plan and you just really want to put it in there because it ties into a priority area that you want to address in the future, but you just don't have that level of specificity yet, then I think that's fine, again, to just reflect where your community is at in the process.
Good. Thank you. Thank you for your questions. And again, keep in mind if there's anything else that you'd like to chat about at the end. I'm going to ask that everyone check to make sure your phone is on mute or your laptop or computer's microphone is turned off. Star 6 if you don't have a mute button on your phone. And so some takeaways from things that we'd love for you to keep in mind as you put together your next LMCH plan around the objectives. Please keep them SMART and include a baseline and a target. Make sure that they're really logically related to both your strategic issue and your MPM, FPM, LPM. And again, if this is challenging, we know it's challenging, so reach out for help if you get stuck. As you think about your strategies, again, we know you didn't have quite enough time to do the good action planning process as part of the LMCH needs assessment next year. So feel free to revisit those webinars, revisit those steps in the process, and think of developing strategies, first of all, really clear to the reader of your LMCH plan that are reflective of the evidence base and reflect public health strategies in addition to health education, which we know is super important. But can not necessarily always get at the root cause of the challenge that you've identified and want to tackle for this population in your community. So output. Want you to think about indicate a strategy was implemented that are very clearly defined so we know what you're tracking to know if your strategy was implemented and are logically related to your strategy. We're still getting feedback here in the room, so again, I know it's such a problem that we can't mute on our end, but we'll fix that. But for today, if you could just double check that your phones are muted, that will help as we wrap up for today. So, so starting to wrap up here in terms of next steps, we wanted to reiterate again that the LMCH SharePoint site is a great resource. We have the past webinar slides are all posted on that site. A variety of the webinar recordings are posted there as well. The same resources, ways to gather community input, just resources are posted to that site. Today's recording, probably tomorrow, will be posted on the site, and the slides are already posted there as well. You don't log in or anything to get in, so you can just click the link that's located on this slide. I'll actually take us to that site right now just to show you where today's located. You should be able to see my screen. When you get to the site, alongside there are various folders. And you go to the link for the LMCH webinar presentation slides. You'll see here preparing the FY19 MCH plan webinar.
are posted, you will just click that link, and it will pop up, and you can download those slides to your computer, and you'll be able to save those to your desktop. So that is located there. Additionally, if we just go back a little bit, in terms of the webinar recordings, a lot of the previous steps are saved here. So if we go to step 7 and 8 webinar recording, so that was wrapping up the LMCH needs assessment, and this might be a really relevant one as you're moving forward developing your FY19 plan. If you just click that link, it's going to take you right to YouTube actually, and it will just have the entire recording and slides there. A couple links that we are working to fix that you may notice, the Systems Assessment webinar, and I believe one other, we are uploading to YouTube. Most of the links you'll find here are live, and you can listen to those fast forward, what will be most helpful to you. Let's see. So go back to our presentation. So again, the live link to the SharePoint site is located on this slide. I'm going to turn it over to Trudy for the next steps for the FY19 plan.
We sent out the FY19 local MCH notification earlier this week, so if you did not receive that, let Robin and I know, and we'll forward that to you. The local MCH plan is due on Friday, March 23rd. Please email it to us, as you have done in your past, to our MDHHS maternal-child-health@michigan.gov. Each actually is on the next slide. And Rob and I will review your plans, and then once we've reviewed it and approved it, we will put a stamp of approval on it. We'll send that back to you via email so that you can forward that to your finance person, who can then upload the approved LMCH plan with the budget application onto eGram. And that's the same process that we used previously. The finance person will attach the local MCH plan to any of the detailed budget lines on eGram budget application, not use miscellaneous tab, just one of the detailed budget lines. So that's the next steps as far as the plan, submitting plan and getting it to us. If you have questions about the plan, feel free to email us or call us if you want a one-on-one consultation to help you work through any issues about the plan. The LMCH team is here to help you. MPHI is here to help you with specific components as well. So feel free to reach out to any of us if you're having any struggles, questions, concerns. We are here to help you and to support you and to make the process be as simple as possible. So any other questions that you have that you've thought of that you would like to pose to any of us? We're happy to answer any questions in any way that we can. And so is there anything that we missed on this webinar that you really need more information about, that we can think about how we can get that information to you as we move forward in the fiscal year? Yourself if you have a question.
This is Karen, District 4, and I just want to thank you ladies for being so helpful and so living. So thank you so much.
Happy.
We will wrap up our webinar now. Thank you so much for joining us today. Have a great weekend and safe travels if you're on